for parents that, have a difficult case and they're really leaning more towards the pharmaceutical route, what would be some insight on explaining why doing it this way versus the pharmaceutical drug route? What would be the case for doing it the biomedical route?
I know just from my experience, a lot of, and there is research has shown that kids with ADHD start on medications. By the time they get into their teens, they'll get a secondary diagnosis like anxiety. So, and they start one medication and then they'll end up with two, and then they get an additional diagnosis and they end up with three. I believe that, and not just me believing, the studies show that you have to treat the underlying cause because we did not have this epidemic of ADHD, anxiety, all these psych disorders, autism. We did not have this back in the 60s and the 50s. It was not this prevalent. So I believe that there are some underlying issues in the body that's causing the child to be anxious, lack of focus and attention. So I believe that just testing, just like any other medical problem, you go ahead and you test and you try to treat the underlying cause, changing the diet, then you get it takes a longer time. But when you do, you're treating the underlying cause. You're not just treating the symptom. Okay, you see hyperactivity, I give you a stimulant, and then you're calm and you can sit for studies. That you're just covering up or just taking care of the symptom, but not the underlying issue. So I think long term, um, if you just treat the underlying problem, then you will not need medication in the long term.